Hello there, this is Gershom Senjumba presenting to you Dynamic Bid Intelligence, a web application tool that is designed for hospitals to predict the number of days that each patient is going to stay in the hospital bed, and so that they can have an overview of the bed occupancy rate each day, which is what they are lacking, especially in sub-Saharan region of Africa. The first person to use this application is the nurse who comes into the application when entering the new patient. He or she records the information like ward that the patient is coming into, general medical, he's a male, he lives in a rural area, he comes by referral. We fill this information, we can increase to 36 years of age, distance to hospital since we said rural, let's add more kilometers, and temperature has increased a little bit. Heart rate, maybe let keep other vitals as they are. We have a primary diagnosis which is anemia. We have a severity which is moderate, and we have comorbidities. We leave them as they are, no entry, and the social factors which are crucial features in this model predictability. And on entering the patient information, the model predicts how long this patient is likely to stay in the hospital. Here it says it is from 2 to 60 days, and there is this number 47, which is clinically called bed availability score, which is used by the doctors, of course, and it ranges from 60 to 100, where it says that the bed is likely to be freed up early in within 24 to 48 hours. And when it is 35 to 59, which is our range here, it says that this patient may stay long or may go home early, because going home early it's within 1 to 3 days, and going home late it's from 4 to 7 days. And this application is integrated with Shapley additive explainability. This is an approach which is integrated with the machine learning models to give the prediction results from the numbers to the language that every human who does not have machine language skills to have understanding of what the results of the model are. So here it says that having transport arranged decreases the chance of staying longer, and that is what a doctor can easily understand. And on this side, we have other features, but these are done especially by an operations manager. Entering as an operations manager, here is the dashboard that he sees. Each day, he sees the number of beds which are occupied. Since we've added one, it's now 121 beds occupied already, and it shows that 41 beds are going to be freed soon, and it shows that we have 229 beds. And now he sees the statistics for each ward. Here we see maternity, we see general medical, we see pediatric, and other wards that are in the hospitals may be added as well. And if he clicks on one word here, he sees the number of beds and the patients who occupied in the hospital. We have a total of active patients. We have five freeing soon, and we have two taking long. And we can click on each patient to see the detailed information of that patient, and when that patient is freed up, mark patient as discharged, and For the model retraining, we save the feedback that is given by this operations manager at the hospital. If it's correct, he clicks correct or incorrect, and here we mark it as correct, and the model will retrain if there are more incorrect answers. And still on the operations manager, he can have the timeline where he can see the number of uh, patients going to free up the beds within 24 hours and within 48 hours up to within 72 hours. He has another feature which is forecasting. Here he can see that it is predicted that 40 beds are going to be freed up, and there is 5 patients expected to be coming into the hospital. But this is not a prediction; it's a it's an average which was computed from the historical data that is recorded in this application. And he can do the configurations like changing the word numbers in each the bed numbers in each word, where he has each word and the number of beds available, and he has an audit log to keep track of what's the action done in the application, and the feedback to know whether the model is predicting well as intended. Thank you for watching.